Hi, I'm Dr. Dan Shapiro. I'm a board-certified plastic surgeon, certified by the American Board of Plastic Surgery. I've been practicing in the Scottsdale, Paradise Valley for over 21 years. Today I'm talking about how do I choose the correct breast implant size for a patient. And everyone thinks, or a lot of patients come in and think that it doesn't really matter what their body is like, they can get whatever implant size they want. And it really depends upon a lot of things all at once. The first thing is what the patient desires. Some patients desire a smaller implant, some patients desire a large implant. It's very common for people in the A to B cup size to want to go into the C and D cup size, and that generally can be done. The first thing I do when I meet a patient is I ask, of course, what it is that they're looking for, and then I examine them. And the important measurements that I look for are the breast sternal notch to the nipple distance, and then how much the breast hangs. That's a very, very important measurement. Probably the most important measurement that we need to take in consideration is how wide someone's chest wall is. And I measure the diameter between the medial portion of the chest wall and the lateral. And that really tells me what a patient can accommodate with regards to a breast implant. After we do that, I also determine how much laxity there is in the skin of the patient's chest wall. So all of those measurements go together to formulate some kind of feeling about what I can do with a breast implant. There are different sizes and shapes of breast implant. Nowadays there are smooth and textured that are used for various regions. But generally, in terms of determining the size, I ask a patient to bring in pictures, and then we go over pictures and decide what it is, whether maybe they want a B, a C, a D, if someone is athletic, if they're afraid of getting of having their breasts in the way when they're doing athletic activities. So we try to narrow down to some kind of range in terms of a size. And then after that, I go ahead and have someone put on a temporary bra, and we actually try the breast implants within that bra to get a feeling of what patients want. When I get to that range, I have an idea basically of 2 or 3 sizes that I can use, and again, I have patients go home and do some homework and bring in pictures from Victoria's Secret or something like that to tell me what it is that they're looking for. When it's time for the operation, I go in and I use some of those sizers. These are temporary implants that I put in during the operation, and then I sit patients up and I see exactly what patients look best in terms of what implant to meet their expectations. Now, people ask me, how often do I have to change an implant because it's too small or too large? The answer is almost never. The reason being is that communication is the key, and expectations need to be met and hopefully exceeded. But I think the most important thing is for people to have reasonable expectations, to be honest about what they're looking for, and don't be dissuaded if in fact it can't be done. A lot of times the patient thinks things can be done and they go somewhere else and come back to me disappointed. So again, the most important thing is honest communication, a very thorough physical examination, and get an idea visually of what you're looking for. Thanks a lot.